Well, yeah, so yesterday Providence Everett had about 40 patients waiting in the emergency department for beds. Today that number is 30, and while COVID cases seem to be on the decline, their hospitals are still treating high numbers of patients. Providence Regional Medical Center in Everett treated the country's first COVID-19 patient back in January of 2020.
It's disappointing that we're still in this position.
And this week, more than a year and a half later, the hospital is so full, surgeries are being postponed and patients are waiting for beds.
As of yesterday, we've opened up a 6-bed satellite ICU to care for additional ICU patients because we're out of bed capacity in our normal ICU.
And Providence isn't alone in this.
We do find ourselves with our backs against the wall very frequently.
The Washington Medical Coordination Center at Harborview works to find space for patients when hospitals don't have room for them. During a meeting this week, Director of Operations Mark Taylor explained that while the Coordination Center's number of calls decreased about 50% since August's peak, numbers of hospitalizations are still higher than they were in previous months.
Hospitals are still extremely full. There are pockets of facilities that find themselves with very high challenges and difficult management decisions that need to be made for how they're going to care for the number of patients in their hospital.
Even though they're going down, our case rate is still very high, and as a result, we're still seeing a large number of patients coming needing hospital care and ICU care that are still getting COVID.
Well, Reddick says they are still treating all patients that come through their door, but they're telling people to expect some long wait times at the ER. And he's encouraging people to get the COVID-19 vaccine and take COVID precautions as the holidays are kind of coming up on us in a few months. Live in Everett, Kayla Lafferty, King 5 News.